Hello, I'm Cole Janique here at Mic Check with Dr. Eddie Hamilton of Centennial Pediatrics. How are you?
I'm great, thank you.
I am so honored to be doing this interview.
Well, thanks for having me.
I'm just in awe of your accomplishments and the things that you have done that people probably don't even know that you do. Now, you have the largest private pediatrics practice here in Middle Tennessee.
Probably.
That's impressive. That's very impressive. So, how did you get started?
Well, in terms of my practice, I trained at Vanderbilt in medical school and also did my residency there as well, and decided to go into private practice at that time, and that was 1988, I believe, and joined a group of pediatricians here in the city, in the Southern Hills area. Worked for them for about a year and a half, and just decided that I wanted to do things a little differently. That just seems to be my nature. And so after about a year and a half with them, I went on my own and opened a solo practice with just me and a nurse and a receptionist and an office manager.
Okay. What made you choose pediatrics?
Well, I always wanted to be a doctor. When I was growing up, that's when people asked me what I wanted to do, I always said I wanted to be a doctor. I was lucky enough to do well in school and got a lot of positive reinforcement from my family, and I always wanted to be a doctor. And so went to college and actually majored in engineering. But it was a scholarship at the time, and it seemed like it made sense at the time. So I went that direction, majored in chemical engineering, and at University of Tennessee in Knoxville. But decided I still wanted to go to medical school. So I did, applied to Vanderbilt, got in. And while I was there, you do rotations in all the disciplines. And the people that I felt like I was most like were pediatricians. I was more comfortable with them. And I always tell people what clinched it for me was I spent time working at the VA hospital here in Nashville, and where I was taking care of chronically ill adults. And while they need care as much as anyone, but the things that they needed care for were things that I felt like were sometimes self-inflicted. A lot of alcoholism, a lot of drug addiction, a lot of people with emphysema or lung cancer from smoking, things like that. And so I just was more empathetic and had more caring, concern for children, because what was wrong with them usually was nothing that they brought on themselves. So that kind of clinched it for me, spending time at the VA. So you started your first practice in 1994? 1990 is actually when I went on my own as a solo doctor, and opened the second location in 1994.
How many providers do you have?
Right now, our practice has grown over the years. We now have 11 primary care sites, which means general pediatric sites. And that consists of about 50 providers altogether, mostly pediatricians. I think we have about 36 or so pediatricians, and the rest are what we call mid-level providers, nurse practitioners and physician assistants.
And so you started your next 3 offices in 1998?
I did. 94 was the year they created TennCare, and because at that time a lot of people were opposed to TennCare, just like right now they're opposed to what they call Obamacare. I call the Affordable Care Act, but a lot of resistance to change. And so a lot of the doctors in the city at that time were saying that Medicaid managed care was not going to be a good idea, and they were saying they weren't going to take care of kids on TennCare. And I knew that meant that disproportionately those were going to be kids that were African American and kids that were poor, or both. And so I said, well, those kids still need care, and they need good care. So I decided to open a second office and use nurse practitioners, because at that time they weren't widely used in primary care, in medicine really. And so I was able to go to the state and let them know what I was trying to do, and they actually assigned me 4,000 additional patients on the day TennCare was started. So I kind of had an instant practice right then, and was able to staff it with nurse practitioners, and I would split my time between the 2 sites then. And we provided great care and had good outcomes, and despite a lot of people who were critical of us at the time, it worked out very well.
Just thinking of the thought of so many people who don't have health insurance, it makes a big difference that you accept these patients that are on TennCare, Medicaid, and you accept all forms of insurance.
Exactly. I mean, one of the injustices that I still saw as a resident was there's still kind of two societies, the haves and the have-nots, or the have less than. And I just couldn't understand, still at that time, in the late 80s, why we still had a system like that. And of course now, some 25 years later, it's still, in some ways, still not equal. A lot of inequality remains. And so I've always kind of fought against that. But the thing I knew I could help was make sure that every child had access to the same quality of care, regardless of their insurance status, regardless of their ethnicity or their geography. None of that should matter. Kids all need the same care, and I think we've done a good job providing that.
Yeah, and I also want to talk about, you also have a location in Southern Hills where you have bilingual staff, because Nashville does have a very large population of Hispanics in the community, which is
Absolutely.
a really good thing that they can go to this location, because in that area it's a large population of Hispanics. So
it is.
That's really good that you have a bilingual staff there.
That's right. Ironically, people don't know it, but that was actually that second location was the Southern Hills office.
Okay.
And so when we started, it had a certain mission, but then over time it really evolved. It's now our largest office, our in terms of patient volume and number of providers, it's our biggest office. And it's a very, very diverse area of town. There's a large Hispanic population there, and we've adapted by making sure our staff and our providers speak Spanish, but we also have a large international population there. A lot of families that are Kurdish, a lot from certain parts of Africa and Asia. Even some Chinese dialects that we have a hard time with people speaking that language, but we tend to make do. Usually the parents will bring in someone who speaks English with them, and there are translation services available, but it's a very, very diverse practice, and not just in terms of the traditional black and white kind of makeup, but it's a little bit of everything.
Okay, and something that I definitely want to talk about real quick is your foundation that you've started.
We did. It's called the Centennial Pediatrics Foundation. We started that, I think late 2009 is when we first started, and really kind of got the charter up and going in 2010, I believe. And we have a great board. Some well-established community leaders are on our board. They're very engaged and very supportive. We have recently hired our executive director. Her name is Nancy Whitman.
Okay.
She came to us from Nevada, and she's got a lot of experience in children's health and in state government. And so we're really at that point where we're on the threshold of doing some really big things in terms of procuring grants and trying to find creative ways to fund our efforts. What we want to do with our foundation is really just to support the mission of our practice better. Our practice mission has always been to provide exceptional care to children and to focus on patient and parent education. And we also want to do some research. And so I think in order to be able to do research, we need that nonprofit arm of our practice that puts us in a position where we can get funding for grants, where we can measure outcomes and show that we're not just saying we're good, but we really are good, and we can measure that.
Okay, and to let our listeners know where they can find out information about your practice, is there a website that just people in general can go and check out and get information?
There is. Our website is www.centpeds.com.
Okay.
CentPeds is short for Centennial Pediatrics, and I'm sure you'll see it on the screen when they edit the tape, the show that we're doing here today.
Okay.
But it's centpeds.com, and we have a great website. It's very interactive. Patients can actually go on there and learn about our practice, our locations, our providers. They can make appointments. They can even offer questions to our nursing staff and have those questions returned. And we want to make it as interactive as possible. It's also a good way to introduce people to our practice. And there's a link directly to our foundation on their website.
On the website, okay.
Yes.
Well, I have enjoyed interviewing you and just letting people know about you and what you do in your practice. And hopefully we'll be able to get you back on and just talk about it a little bit more and about your foundation and how people can support it.
That'd be great.
So I am Cole Janique here with Dr. Eddie Hamilton of Centennial Pediatrics. And this is Mic Check.